This segment of DelmarvaLife is sponsored by TidalHealth.
Surgeons spend their careers on one side of the operating table, guiding, repairing, and reassuring. But sometimes that surgeon can become the patient.
So today, we felt it was appropriate to share a powerful story of resilience, perspective, and returning to purpose. That's why we decided to bring in Dr. William Doran. He is a surgeon with TidalHealth Orthopedics. Dr. Doran, it's so good to see you.
It's a pleasure to be back.
Okay, so we understand you recently had surgery yourself.
I did. I had a wrist surgery on my right wrist.
Oh.
Yes.
So what was that like?
It's interesting to be on the other side of the table. It does create a level of empathy as I return back to the office and in preparation to go back to the operating room. I've been able to discuss with some of my patients and even reiterate the fact that I have a true level of empathy at the moment, like much more than I feel I normally would, but it's been a difficult but a good experience.
Okay.
Yeah, I'm sure it gives you a different perspective. So when are you going to start seeing patients again?
So I started seeing patients in my office in the middle of October, and that was one of the reasons I actually wanted to come on this show, because I heard a bunch of rumors of what had occurred to me during what caused my injury, etc. So I've been seeing patients, and we're preparing for surgery at this point. Surgery is start in the beginning of January. I resume kind of my normal care.
I know you're looking forward to that.
I am looking forward to it.
So your practice focuses primarily on robotic surgery, and I got to read this. Could you explain what anterior robotic hip replacement and robotic knee replacement involves, and what are the benefits?
Excellent. So first, there are different approaches that for hip replacement. You can go through the posterior, lateral, or anterior. The anterior does have some significant early benefits where it gets you up and moving a little bit faster, and it's a little bit less painful, decreased chances of dislocations, etc. And so those are some of the reasons why I do that approach. In terms of the robot, it provides for a very precise placement of the acetabular cup that goes into the hip during surgery. And having good placement or precise placement will it can decrease your chances of having dislocations, which are some complications. So you can decrease the risks of complications and improve the speed in which somebody will recover. And some of those same precision aspects of using the robot can be applied with the knee as well. And so that's one of the biggest reasons why I do that, reproducible precision.
Sure, sure.
So robotic surgery is really advancing rapidly. So are you excited about what's to come down the road with this procedure?
I am. So I actually just had the opportunity to go down to Florida to see the next generation of robots, and it's something that TidalHealth, with our interest in staying innovative, we're looking at the newest system that they just created, and so I'm really excited for that. It has new applications with revision surgeries, not just primary surgeries, and also shoulder application is on its way. So we're pretty excited to see the next steps for it.
For someone who may have hip replacement or knee replacement in the future, do you have any advice for them?
So one of the nice things that we try to do is to delay surgery as long as possible and maximize any conservative measures. But if the inevitable may arise where you do need surgical intervention, having that conversation with a surgeon, strengthening muscles, maintaining as much stretching as you possibly can are always good things. And then just that conversation with the surgeon, they'll be able to guide you specifically for an individual circumstance.
It's not our grandmother's surgery anymore, is it? It's
No.
come a long way.
Correct, yeah. And just it's amazing to see the technology and how it can benefit people in the long run, both short run and the long run.
It's wonderful. Dr. William Doran with TidalHealth, thank you so much for being here.
It's my pleasure.
And enjoy the holidays.
Thank you.
And
Same
good
to
luck
you.
getting back into the operating room.
Yeah,
Yes.
we're excited. The wrist is working again. We're excited for it.
Excellent.
Wonderful.